Ukuthula akube nani. Namhlanje we are blessed to have a therapist who can assist us as we speak of the autism, because most of the people do not understand, including myself. Sometimes I get lost. So we have a brief background and also the symptoms. She can help us with what we look for as parents in trying to assist and take away the stigma that is always associated with people with a disability. Ma'am, how are you?
Good, thank you. And you?
Can't complain. Who am I speaking to?
My name is Krepaloshni Pillay.
Yes.
I'm a speech therapist at the Tongat School for Elson. Elson is learners with special educational needs. Okay, with regards to identifying signs and symptoms of autism, a lot of parents are unsure of what to look out for. So some of the common signs are, at a certain age, your child is not making eye contact with you.
Meaning he's shying away.
Is shying away.
Okay.
They're playing by themselves. They're not starting to talk at the normal ages, the usual ages that other children do. Right? They're doing things like they're waving their hands, they're shaking their bodies.
Is this on their own?
Yes, they're on their own. Some things like noise, lights, all of that tends to bring out these reactions with them. Parents will say, I can't take my child out to the mall, I can't take them to church, I can't take them to a function because they're doing this, they get, yes, and then they get agitated and they're doing all of this. Some children are even screaming. Some are screaming, some are biting, they're sticking their hands into their ears. All of these things are the common symptoms. But what's happening more recently is we're finding that some children at the age of 2 are able to read. They're reading full words, right?
They are above normal.
They are above. Now remember, autism is a spectrum, which means you're going to get some children that are very low functioning and you're going to get some children that are very high functioning. So you would have heard of a term called Asperger's, where the children are actually very good and very fast in their development. Yes. And they have what we call pockets of very special skill. So they'll say to you, my child can't read, but they can program. They can play games. They can actually build an entire puzzle of 500 pieces, right? Those are all special skills that people that we consider to be on the spectrum of autism would have. So the most important thing in identifying a person with traits of autism is to go with the mother or the parent's instinct. If they say to you, I've noticed something that is different and I'm not sure if it is a problem, please investigate it.
All right.
Because parents are the first ones, parents and grandparents are the first ones who will identify whether something is usual or unusual. And you might as well err on the side of caution. You might as well check, because the earlier you identify a problem is when we can actually help as soon as possible.
I see, but this is happening at early stages, right?
Very early stages.
If it's not detected, the child can end up on the street.
That would be an extreme case.
On the street, in the sense that when I take my child to school, and the child is not copying, and then the child will end up being ignored, because it's not normal.
Yes. So that is why we try to help the early childhood development centers, the creches. We try to empower them to identify issues and act on it as soon as possible. Even within schools, you get the grade R, where if a teacher identifies a problem, we say, yes, bring the child, let us assess, let us see if there really is something, or they're just a little bit slower on the normal spectrum.
I see. Is there any cure or medicine that one can advise the parents to use?
No, there isn't a cure.
Right.
for autism,
I see.
right? Autism is not a life-threatening disease,
Disease.
right?
Just a
Yes,
behavioral pattern.
it is a disorder of communication, of socialization, of language. Most often, the common criteria, the most commonly used identifying factor is that the child is not developing speech and language as they
Normally.
should.
What advice can you give to the parents, for those newborn, what to look for? I heard what we've covered, but
Right.
just basically to say what is it that they can look for to be able to identify if there's a challenge.
Just have a very high rate of suspicion. See, as we were growing up, autism was not such a commonly known condition.
Right.
It was always there.
Right.
But now, if you look at it, every second, every third, fourth child is being diagnosed with autism. Right. Going back to what you'd asked about treatment of this, there's various things that people try to minimize the effects that happens within the child. For example, a lot of people will try traditional medicine. They will try Western medicine.
Right.
They will try their cultural beliefs. Understand, though, that all of these will help alleviate what we call symptoms, but nothing's going to cure it.
Bottom of it.
Right?
That's it.
But having prayer, having your cultural beliefs, as well as accessing Western medication and services, all together contribute to enhancing and uplifting a child's life.
Ma'am, I wish we had all the time, but thank you very much. It's very enlightening because most of us, in our traditional way of going, in our culture, there was a saying, "Uthi asikho isilima esindlebende kwa," meaning that in the family, it's where these kind of people need to be protected.
Absolutely. The parents are key. And a lot of times, parents abdicate their role as parents and pass it on to grandparents.
I see.
Right. Remember, grandparents are aging.
There you are.
They have their own time with their children. They've raised you.
Now
It's
you are
not their
forcing them
job. It's not their job to raise
back
your
and raise-
children.
Yes. I understand.
They're
that.
meant to enjoy their
But the current
grandchildren.
situation is mainly,
Absolutely.
I would say 90% of
Agreed.
the grandmothers are looking after the
Agreed.
children, which is a problem.
Agreed.
And also, parents as well, they do have this tendency of speaking down to learners. They
Yes.
say, your sister is now younger than you, maybe doing grade 12, you're still lingering.
That's also a problem. You should never
Say
ever
anything
compare two children. No two children are the same. Neurodivergent, neurotypical, no two children are the same.
Thank you very much, Bem.
Thank
I
you
wish
for
we would
your
continue
time.
again so
Thank
that we
you.
can learn. When we do our own without you present, we'll learn a lot from you and then we'll share with the nation. Because that is where the problem is. Thank you
Thank
very
you.
much.
Thank you.
Thank you very much, guys. So we have learned a lot today.
Thank you.
From now on, you need to understand. You say, don't compare your children. Whether you think it's clever, smart, or stupid, it's not going to happen. Thank you very much for watching.